I'm Dr Helena, and after 30 plus years in medical practice, I realised there's a lot missing from modern medicine. Education is more powerful than medication, and our decisions have more impact than our DNA. Think about this for a moment. Modern medicine has made the most staggering advances. We've mapped the entire human genome. We've synthesised hormones. We've implanted embryos, and we've transplanted hearts, lungs, livers, kidneys and pancreases. Yet we're getting sicker, more tired and more depressed by the day. And we're getting sicker at a younger and younger age. And it's not just one disease that's on the rise, it's all non-infectious diseases. Allergies, autism, autoimmune diseases, arthritis, cancer, diabetes, depression, anxiety, food intolerances. The list goes on and on. It doesn't make sense that in this age of technological marvels, we aren't making a dent in defying disease. Modern medicine is obviously missing something. And that's why I've started this podcast. I'm Dr Helena, and I obtained my Bachelor of Medicine and Surgery from the University of Sydney in Australia in 1995. That's equivalent to an MD in the United States. But what I've discovered is that education is more powerful than medication, and our decisions have more impact than our DNA. And after 30 plus years in medical practice, I realised there's a lot missing from modern medicine. Don't get me wrong, I don't want to throw the baby out with the bathwater. Modern medicine is excellent at treating emergencies, acute conditions, ruptured appendices, severed parts. It's brilliant at describing the biochemical mechanisms that underlie a malfunctioning system. But the short-sighted approach of merely eliminating symptoms comes at the expense of seeking out true causes. And it comes at the expense of true healing. Because Western medicine is not about healing. It's about repairing. It's about fixing things that break or block or burst or burn or bleed. It's about restoring function to a malfunctioning part. Healing, on the other hand, is a journey of empowerment without attachment to a predetermined outcome. We don't necessarily know where we'll end up. But the irony is, from what I've seen and experienced, if we let healing happen, and I do believe it's a process of allowing, we end up in a far more amazing place than we ever imagined. I believe the ultimate role of modern medicine is to keep us alive long enough to allow us the opportunity to heal. So, the purpose of this podcast is to explore the real nature of disease, to investigate how and why modern medicine has gone off the rails, and to discover how we can truly heal physically, psychologically, and emotionally on a personal and planetary level, because they're all inextricably linked. What's good for our body is good for our brain, is good for our gut, is good for our heart, is good for our mental health, is good for our body, is good for our brain, and round it goes. And that's the first thing that's missing from modern medicine. The recognition that we can't separate our physical health from our mental, emotional, and planetary health. Yes, doctors will reluctantly admit that stress can weaken our immune system, and they might even go so far as to say that stress can worsen heart health. But then no one does anything about it. And stress is only scratching the surface, because everything in our lives affects our health. Not just the obvious things like what we eat, whether or not we exercise, how much we sleep, but also what we think, what we say, what we believe, the quality of our relationships, whether we're living in alignment with our values, and whether we have a sense of meaning and purpose. And even that's not an exhaustive list. Our body and brain are a reflection of our past traumas, our current habits, our buried fears, and our future hopes. Our health is also a reflection of our physical environment, culture, and community we live in, which is one of the reasons I think modern medicine steers clear of trying to probe the bigger picture. It feels too big and too daunting, but it's also potentially exhilarating. And it's essential if we want to turn the tide on the ever-expanding epidemic of chronic diseases, physical and mental, that are affecting just about all of humankind everywhere on the globe. So, I invite you to join me on this podcast to explore what's missing from modern medicine and to embark on an exciting, transformative journey to vibrant health, lasting vitality, and a truly fulfilling life. This podcast is for people for whom modern medicine isn't delivering enough answers and doesn't provide a cure. It's for people with diseases like Alzheimer's and other dementias, which was my father's journey, cancer, which was my mother's journey, Parkinson's and other neurodegenerative diseases, which is many a friend's journey, and obesity and emotional eating, which was my journey. And this podcast is for people with a myriad of other chronic conditions, such as, but not limited to, type 2 diabetes, arthritis, fatty liver disease, heart disease, infertility, menopausal symptoms, mental health problems, and all those other conditions we're told we just have to learn to live with and manage as best we can. This podcast is also for people who feel well enough, but want to boost their brain to perform at their peak throughout their life. For people who want to avert Alzheimer's and other dementias after retirement, who want to stop the cognitive decline we've mistakenly believed was inevitable with aging, who want to live longer, stronger, healthier and happier, and for people who want to come alive and thrive rather than merely survive. Because I'll also be discussing really practical things we can do to improve the functioning of our brain and body. So really, this podcast is going to be an exciting exploration of you. What motivates you, what makes you tick, what derails you, and most importantly, what empowers you to be at your best, at your healthiest, at your happiest. It'll be an exploration of how we can all build a smarter brain, stronger body, and deeply satisfying life. But a warning. Some of the ideas I present may challenge your existing worldview, which is actually a good thing, because stretching ourselves to think differently, to entertain new possibilities, not only creates new opportunities for health and healing beyond our wildest expectations, challenging our thinking stimulates the formation of new connections between our brain cells. And this is the foundation of neuroplasticity, our ability to change our brain for the better. But neuroplasticity can also work in reverse. We can erode our brain function if we consistently engage in thoughts and behaviours that undermine our physical and mental health. Now, a word about the structure of this podcast. I've structured it in a way that I think will be most useful, relevant, engaging for you, the viewer if you're on YouTube, or the listener if you're tuning in to audio. Each podcast will start with a brain booster, an immediately implementable strategy to boost your brain. So if that's the only thing you're interested in, you can tune out after that, but you won't want to, because the second segment is health headlines. Here I'll discuss what I believe are the most pressing subjects related to achieving vibrant health and healing from any disease or illness, including those that modern health labels as chronic or incurable. So this will challenge the way we currently view disease and offer a new paradigm for healing and attaining lasting vitality, which will lead to the third segment, where I answer the question, what's missing from modern medicine? Because as I mentioned earlier, in my 30 plus years of being a doctor, I've discovered that modern medicine has a lot of blind spots. One of which is that it mistakes symptoms for diagnoses. A headache is not a diagnosis. A headache is a symptom. The question is, of what? Taking a painkiller might remove our awareness of the headache, but something is still going on that isn't quite right. Lack of sleep, stress, hydrocephalus, a tumour. If we ignore the headache, we could miss an opportunity to discover something important about ourselves. Now, of course, not every headache is a sign of something sinister. It could be an obvious bad night's sleep. And if that's the case, it's a reminder that sleep really matters and you need to prioritise going to bed earlier the following night. Let's take another example. Heartburn is not a diagnosis. It's a symptom. Of what? Too much alcohol? Smoking? Foods that don't agree with us? Stress? A hernia? Carrying excess body fat? Esophageal cancer? side effects of a non-steroidal anti-inflammatory medication. Again, taking an antacid will remove the discomfort, but all drugs come with side effects, many of them detrimental to our gut microbiome, the trillions of bacteria that live inside our gut. So why not address the cause instead? Make this your new mantra. Every symptom is a signal. And rather than regarding symptoms as a nuisance to be suppressed as quickly as possible, why not get curious and ask, what is my body trying to tell me? Asking that question can be the start of a beautiful and empowering relationship with ourselves. It sounds like a cliche, but it is so true. And it's a subject we'll explore extensively throughout this podcast series. Now, headaches and heartburn don't sound like a big deal, but they're good for us to practice an empowering approach to self-healing because the same principle applies to all diseases. Now, I also get that everyone is stretched to the max, time poor, busy beyond belief, so you don't have time to navel gaze over a headache. I hear it from patients all the time. I just want to get rid of it and get on with everything else I need to do. I understand. I've also been there. But ignoring symptoms eventually catches up with us. Mild symptoms are a small nudge. You can usually get away with stomping them out with a drug, but not indefinitely. Symptoms morph into increasingly stronger signals if they're continually ignored. So next time you experience a headache or heartburn, at least pause for a moment and ask yourself, what might have brought this on? What is my body trying to tell me? Even if you don't do anything about it, asking the question is a step towards better long-term health. Cancer is not a diagnosis. It's also a symptom. Of what? The more serious the symptom, the deeper we need to delve. And we'll do a lot of delving on this podcast. Because only when we explore the true nature of disease, when we seek out root causes rather than merely mask or suppress symptoms, that's when we will become the exuberantly healthy human beings we were designed to be. The fourth and concluding segment of each podcast will be the weather report. Weather being spelt W-H-E-T-H-E-R, as in the start of a question, not weather, W-E-A-T-H-R, as in climate. So what's this segment about? The weather report is where I'll answer your questions. And just for the fun of it, please ask your questions about any health-related topic using the word weather. For example, I'd like to know whether margarine is healthier than butter, whether we really need to drink 2 litres of water a day, whether being born by caesarean section increases the risk of a child having health problems throughout their life, whether alcohol is really a carcinogen, whether vaping is worse than smoking. You get the idea. You can fit any question into a weather format. You might just need to be a bit creative, but that's a nice little brain-boosting exercise in itself. And please send your questions and feedback to podcast@drhelenapopovic.com. So let's get started. Your first brain booster is start with a reason, not a routine. What is a compelling reason for you to become proactive about your brain health? And what do I actually mean by brain health? According to the World Health Organization, and I agree, brain health means the full range of cognitive, sensory, social, emotional, behavioral, and motor capacities that enable a person to realize their full potential over the course of their life. So brain health is more than avoiding disease and dementia. It's about thriving, engaging, adapting, and staying mentally agile. And this is really important to keep front of mind because you won't take action to boost your brain if you aren't clear on how crucial it is to put brain health at the top of your agenda. Everyone's talking about gut health, heart health, which are also important, but our brain runs the show of our lives. Our brain is our command center. If it's not working properly, neither will anything else. You can get a heart transplant, liver transplant, kidney transplant, lung transplant, but you can't get a brain transplant. And when our brain works better, everything else in our life works better. Our work life, home life, creative life, leisure life, all improve as our brain improves. Because when our brain works better, we think better, learn better, create better, relate better. Boosting your brain is the single most important thing you can do to achieve your goals, make better decisions, solve complex problems, and lead a fulfilling life. And when we boost the health and functioning of our brain, we also boost the health and functioning of our body. A study in Dunedin, New Zealand, used brain magnetic resonance imaging, i.e. an MRI scan, to calculate how fast a person's brain was aging. And the faster a person's brain was shrinking, known as brain atrophy, the greater their cognitive impairment, the worse their physical health, the more frail they were, the more chronic diseases they had, and the more likely they were to die early. So the health of our body reflects the health of our brain. And I'll include a link to the study in the show notes. Another reason it's so important to be proactive about brain health is because the changes in our brain that lead to Alzheimer's and other dementias start at least 30 years before we get any symptoms. The earlier we look, the earlier we see brain changes. The health habits we engage in throughout our life, not at the end of it, are the biggest determinants of whether we stay as sharp at age 109 as we were at age 29. In fact, it's never too early to boost our brain because even childhood experiences such as lack of education, illiteracy, trauma can set us up for poorer brain health and an increased risk of dementia as we age. The good news is all these things are reversible if you follow the advice I'll share in this podcast. And no matter how old you are, it's also never too late to make positive changes and see them reflected in enhanced brain function. Dementia is a disease you definitely want to avoid. The World Health Organization, WHO, identifies dementia as a major global cause of death, disability, and dependency in older people. In Australia, dementia is the leading cause of death in women. Very, very few people know that. And the second leading cause of death in men, number one for men, is heart disease. And at the time of recording this podcast in 2025, worldwide, 57 million people are living with dementia, and someone is diagnosed with dementia every 3 seconds, which adds up to 10 million new cases every year. Over 6 million North Americans have dementia. Nearly 500,000 Australians are living with dementia. WHO, World Health Organization, states that the number of people with dementia is projected to rise to 78 million by 2030 and over 139 million by 2050. This does not need to be the case. More than 90% of dementia cases worldwide are preventable. That's my interpretation of the science. The official number is 40 to 50%, which is still very high, but it doesn't include the latest research on how to boost our brain. That's why the information I'll share on this podcast is of the utmost importance and urgency. So, your call to action is to write down at least 20 powerful reasons you want to boost your brain. What are 20 things you will gain by having a better brain? And please do this before next week's podcast. And today's health headline is, what if disease were a doorway? Instead of a defect, a dread, a disaster, a demerit point on the scoreboard of life. Because that's how we tend to view disease, as something to be despondent about. But what if instead we decided to view disease as a doorway? What would happen? I think we'd completely change, in fact, would revolutionise for the better the way we practice medicine and approach healthcare. Because we'd then have to ask the question, a doorway to what? If disease is a doorway, what is it a doorway to? maybe, and I'm only putting these things out there for you to consider, maybe disease is a doorway to truth, growth, freedom, wisdom. Maybe disease is a doorway to deepening our relationships with others and with ourselves. Maybe disease is a doorway to a greater appreciation for what we have and what we're capable of. Maybe disease is a doorway to a clearer understanding of what it means to be human. And maybe disease is a doorway to true healing and life fulfillment. What exactly is disease? And what do I mean by healing? And why do these things matter to all of us, even if you feel well? Being a doctor, I have a pretty simple definition of disease. A disease is something I didn't think I needed or wanted, and which is draining my energy or life force. In other words, the meaning of disease is embedded in the word itself. Dis-ease. Not feeling at ease with our current state of mind or body. And because disease doesn't feel good and often imposes physical limitations on us, like it might stop us doing something we plan to do, either in the short or the long term, because of that, we tend to view disease as a bad thing because it's getting in the way of my plans. But is it necessarily a bad thing? Or is it just a natural part of life? I'm not for a second saying it's a pleasant or comfortable experience. But that's all the more reason to pause and take a deeper look at the meaning of disease and what we can learn from it. And by the way, not every disease is there to teach us a lesson. There are many, many, many different reasons why our body expresses disease. That's why it's such an invigorating and transformational journey to explore. And remember that hard doesn't mean bad. Hard is the price we pay for a more meaningful and fulfilling life. Maybe the function of disease is to make us aware that something in our lives isn't quite right or could simply be better. Now, that doesn't mean we've done anything wrong. It is not about blame, and I'm going to keep repeating this. Taking responsibility for our health is not blaming a person for creating disease. It's about taking a breath and reflecting. It's about feeling empowered that even if I never find out why this disease came about, there is still something I can do about it by addressing what's going on in the here and now. When I've asked audiences of thousands of people to raise their hand if they've never personally experienced any sort of illness, disease, or departure from physical or mental health, not a single hand goes up. I have yet to meet an adult who has never been physically or mentally unwell. So, disease, some form of departure from health, is universal. It's common to all of us. And it's entirely up to us, each individual, whether we choose to walk through the doorway into the unknown or close the door and stay on the side of the known to hold things together as they are. Now, what exactly do I mean by walking through the doorway into the unknown versus closing the door and staying on the side of the known? Walking through the doorway means working with our bodies and not against them, working with life and not against life. Because when I look at the big picture of disease, I believe the underlying cause of all our physical, mental, emotional, and planetary health, ill health, is encapsulated in one word: conflict. Conflict with our basic bodily needs for rest, good nutrition, movement, fresh air, sunshine. Conflict with our psychological needs for purpose and authentic self-expression. Conflict with our emotional needs for meaningful connection and contribution to our fellow humans. And conflict with the ecological needs of our planet. And this conflict is also reflected in our language, as well as in the way we live our lives. We are constantly battling something, be it traffic, cancer, demons, or the bulge. We want to fight infection, defeat disease, and wage war on obesity. We've turned our bodies, as well as our planet, into a battlefield. And this conflict is making us sick. So when disease or illness strikes me, the first thing I ask myself is, what am I in conflict with? Or where is there conflict in my life? Where is conflict expressing itself around me that I'm still absorbing the energy of that conflict? Am I in conflict with my physical or emotional needs? In conflict with my values? In conflict with my partner, my neighbour, my yearning for creative expression? And sometimes being bombarded with conflict when we watch the news, even that can wear down our immunity because we're all connected. And on a deep level, we feel with each other and for each other, even people we don't personally know. I see it as a kind of unconscious empathy. So over the next week, start to pay attention to where there might be conflict in your life. Just observe and see how it makes you feel, and where in your body you might be feeling it. This is a vital step towards healing. And it brings us to what's missing from modern medicine. What's missing is the recognition that just because something doesn't come in a pill doesn't mean it isn't powerful. Sleep, stress management, food, exercise, music, art, family, friends are all powerful medicines, are all more powerful than popping pills. But they take more time, effort, and energy than popping pills. And our medical system isn't designed to recognise this. So it's up to you to recognise it and to choose your path. The path of popping pills or the path to personal power. What's today's weather report? Since it's my inaugural podcast, and this is the first time you've heard of the opportunity to ask questions, I'll answer a question I'm asked all the time. Whether Alzheimer's disease and dementia are the same thing, because they seem to be used interchangeably. No, they are not the same thing. Dementia is an umbrella term for over 100 different diseases of the brain, all of which involve deterioration in one or more brain functions, such as memory, planning, decision-making, speech, comprehension, judgment, navigation. Dementia can also produce personality changes, apathy, a lack of motivation, disinhibition, moodiness, inability to control our moods. So the word dementia is similar to the word cancer in that there are many different types with overlapping symptoms. And Alzheimer's disease is the most common form of dementia. It accounts for about 70% of cases, and it often starts with short-term memory loss, constantly misplacing things, repeating yourself in conversation, becoming easily confused, or getting lost driving somewhere you've driven dozens of times before. Those are some of the signs of Alzheimer's disease. Now, there are also subtypes of Alzheimer's disease based on the age of onset and atypical presentations that can affect vision, language, or behaviour before memory loss, but that's really getting into the minutiae. The important point is that Alzheimer's disease is one form of dementia. The second most common form of dementia is vascular dementia. It accounts for maybe 15% of cases. As the name suggests, vascular dementia is due to reduced blood flow to the brain, which starves brain cells of oxygen and nutrients. And this can result from strokes and conditions like atherosclerosis, hardening of the arteries, or high blood pressure that restrict blood flow to the brain over time. And it can actually be very hard to distinguish Alzheimer's from vascular dementia because they have a lot of overlapping symptoms. And it's not uncommon for Alzheimer's disease and vascular dementia to coexist. And the person is then described as having mixed dementia. That was actually the case with my father. But the good news is that the very same things that prevent and reverse Alzheimer's disease also prevent and reverse vascular dementia. And you did hear correctly. Dementia can be reversed, despite what 99%, make that 99.999% of doctors, neurologists, geriatricians, health professionals will tell you. Do not believe that there's nothing you can do. Do not believe that you can make a major dent in this disease. Do not believe that you cannot reverse it. You can, but not by current medications. Only through concerted lifestyle efforts. Hence your weekly brain booster. Another form of dementia is frontotemporal dementia, FTD, which also has subtypes, and it's what Bruce Willis has been diagnosed with. And the last dementia I'll mention is Lewy body dementia, of which there are two main types, one of which is associated with Parkinson's disease, but not everyone with Parkinson's disease will develop dementia. And I won't list the other 96 dementias. You get the idea. Dementia is an umbrella term for many different brain diseases, one of which is Alzheimer's. And your first step to preventing dementia is today's brain booster. Start with a reason, not a routine. Please note that this podcast is for general information purposes only. It does not constitute medical advice and is not intended to provide specific guidance for any particular situation. The use of this information is at the viewer and listener's own risk and is not a substitute for consulting a healthcare provider.